Hey everybody, good afternoon. It is 12:45 on Thursday, so we are doing 15 minutes of Ask Me Anything. And this one is dedicated to all things keto, except we only have 3 keto questions. So we're going to do 3 keto questions. We have 5 questions left over from the hormone talk with Dr. Schipple we're going to jump into. Actually, there's more beyond that, but we're going to do 5 today. Then we got 2 other questions. So we're going to do 10 questions, hopefully in 15 minutes or less. So here we go. I'm going to jump right in. Oh, and actually one thing, I want to remind everybody here, if your question is a little more complex, and there's a few people I'm going to bookmark after these to say yours might need a little more personal attention, you can call us and schedule a 15-minute See If We Fit. There's no charge to that. We give a little bit of information back and forth and help maybe guide you towards who might be the best person to help you. And if we can do it, we'll do it. If not, we'll help you find somebody who can. Okay, so number 1 question on keto is from a few of our clients, is there any correlation between keto and weird, vivid dreams? I've heard this quite a bit during this keto challenge, and the answer is yes, absolutely. There's a lot of people who do that, and the number 1 thing you want to rule out when it comes to weird, vivid dreams is your vitamin B1 intake. You want to make sure you're getting plenty of thiamine. That is usually the number 1 correlation with weird dreams, and that is one of the things that people tend to not get enough of when they're jumping into a keto diet. So those peely nuts are a great source of it. A lot of nuts are going to be, eggs are going to be a great source of it. Red meat will be a good source of it. So make sure if you're putting information in a chronometer, track your vitamin B1 or your thiamine and make sure you're getting 100% of that and see what happens with your dreams. Okay, next question. Other than fiber being too low for too long, are there any other health concerns / drawbacks with doing the keto long term? Great question. And the answer is not if you're doing it appropriately. If you're doing the high vegetable keto that we're talking about and making sure you're satisfying all of those micronutrients over long term, honestly, you could sustain this and actually be quite healthy. However, I'm a great respecter of nature, and I look at how things tend to happen in nature, and the way I see it is that I would say we need to spend maybe a little more than half the time in ketosis, but we do need to spend some time eating high vegetable content, lots of fruits and vegetables and things like that. So personally, what I do, and this is just what I do, and I don't think maybe it's not necessarily the best way to do it, but it's what works for me, is 2 weeks out of the month, I get into keto. So I always have my first week of the month where I'm doing cleansing. I'm eating really high fiber foods. You hear me talk about beans all the time. And beans are going to keep you out of keto. That's my big drawback with being in keto too much. But for the first week, I eat a lot of cleansing foods, really high in fiber. Then I get into ketosis for 2 weeks, and then the last week of the month, you're not going to believe this, but I kind of take my nutrition brain out and try to live like just a normal person. I still eat 90% healthier than most people out there. However, I'm not perfect that week, so I allow myself to be a little human. So that's a good way to kind of balance it and make sure you're spending some time in keto and some time just not being too crazy about it. But let's think about this from another perspective. If you've been for 30, 40, 50 years solely using sugar as your fuel source, I think it would stand to reason that it would be more beneficial for someone who's done it for so long to spend longer times in ketosis to give their body a long break from that. You want to get back to balance. And if you've never been in ketosis, I do feel like if you're doing it appropriately, getting all of those nutrients we talk about, doing it for a very long time is not a bad idea as long as you're supporting all those micronutrients. Okay, third question. My period has been going constantly since I started keto 2.5 weeks ago. Is that common? Is there something I should be doing differently? Again, excellent question, and I'm so glad you asked it because yes, this is something that does happen a lot when people are doing this. And the question is why? Well, one of the reasons could be, I'm not saying it is definitively the reason, that as you're shedding the fat and as you're starting to lose weight, a lot of times people lose a lot of that during the first week or a lot of fat. A lot of estrogen is stored in the fat, and so there's a lot of hormonal changes happening and your body is dumping a lot of estrogen, or sometimes it could be the other way around. So yes, there's going to be a hormonal balance that's happening at the beginning of this. It should balance out and then get back to a much better cycle. If that doesn't get better, of course, something like that, you do want to talk to your doctor about just to make sure that there's nothing else, because there could be other things that are causing that. But it is not uncommon. In fact, there's a lot of discussion out there in keto chat rooms and Reddit and things like that about this particular phenomenon. So it is common, and it probably has a lot to do with the estrogen, but again, make sure you get that checked out. Okay, those are the 3 keto questions. I can't believe I only have 3 keto questions, but that's great. Keep it up. Remember guys, high nutrients. We have to keep the vitamin B in there. We have to keep the magnesium in there, the potassium in there. We have to keep the fiber in there. There's so many nutrients. I really want to challenge you guys to track those. If you are, make sure that you're hitting your percentages that you need to hit every day on those. Okay, down to the hormone questions. Great question from someone about thyroid. What support is needed to go off thyroid hormones after being on it for 9 years? If you are trying to get off of thyroid hormones, this is somebody who it's going to be a lot more complicated. You're going to want to talk to somebody about that because you really need to look at all of the thyroid function and work with a professional when you're doing that. So if we're talking from a holistic approach, of course you want to be supporting all of the things that your thyroid needs. You want to make sure that you're giving your thyroid and your liver and all of the endocrine system what it needs to be able to function optimally first. You want to make sure your foundations are strong before you actually attempt to do something like that, but always with the guidance of your doctor, or if your doctor's not willing to work with you, find a functional doctor that is willing to work with you on that, because if that's your goal, and there's a lot of good reasons why I understand that you want to do that. I mean, we talk a lot that there's a reason that your thyroid went off and you want to discover what that reason is. So I would use this time to make sure you're strengthening your foundations and helping yourself identify what may have been the reason that your thyroid got knocked off course a long time ago and correct that, and of course work with them. So that's going to be a longer, more specific question to the individual. Okay, next question. How can/does my body get estrogen that it needs being a breast cancer survivor? Okay, so all of this is going to tie in a little bit with the whole endocrine system. Dr. Schipple talked a lot about the adrenals. In fact, the last question, supporting the adrenal glands, would be a big part of that because they are going to be affecting each other. What most people really don't realize, and this is going to answer several questions that were asked here, is that your adrenal glands do actually help you create these hormones. They are incredibly important for this transition, especially women going through menopause. Your adrenal glands are actually picking up the slack for your ovaries in a lot of ways. The reason that it is so dramatic in so many people is because the adrenal glands are so tired. They have been overworked and underpaid for too long, and they're not able to meet the challenge that is being asked of them at this transition. So adrenals support is the number one thing that I would talk about for that person. Now, being a breast cancer survivor, that is going to be a different component, thinking about what type of cancer was it. Was it an estrogen positive cancer? Then you want to be thinking about things that are going to help you get your estrogen levels under control. Remember, fiber, and cruciferous vegetables are going to be incredibly important for helping with that balance. Okay. The next question is progesterone okay to take every day? Great question, because that ties into the last one. I'm going to put a little image down here that we used at the talk just to remind you all. Progesterone doesn't stay as progesterone. There are other things that it will change into. It can change into cortisol. Cortisol is that hormone that we talked about a lot. And it can also go down into testosterone. And then testosterone, there are many changes in there, but testosterone ultimately becomes estrogen. So progesterone is going to become other things. So taking progesterone can still be a concern. You still want to watch what happens at the end of that game and make sure that your body is clearing the estrogen. Estrogen is the one thing that tends to be in overabundance, and it's at levels where it is problematic. So putting in something that can turn into estrogen can be concerning. So that's why all of those, when Dr. Greger shows that report about how they examined all of the hormones, saying whether they're bioidentical or not, they are not considered safe or effective. So keep that in mind. That includes progesterone. And guys, there are progesterone positive breast cancers now too. So just because you were told that progesterone is something that your body needs, this is true, but you need it in appropriate amounts, and you still want to be supporting your body's ability to make that itself. So keep that in mind. If you're putting it in there, make sure you're supporting the end process of it, because that's the dangerous part that we're trying to be careful of. Okay. How does a woman who has gone through menopause make enough testosterone, estrogen, and progesterone? And again, this is what we were just talking about. The adrenal glands are going to be incredibly important for that. So supporting those adrenal glands is going to be very, very much at the top of that list. Now, we also want to look at healthy fats. We have to remember hormones come from cholesterol, which are made from fats. So if you are not getting enough healthy fats in your diet, you're going to have a hard time producing the hormones that you need to produce sometimes. Now, there's a lot of other factors in there. It gets a little more complicated than that. But I would first think about adrenal function, and then I would think about healthy fats and the ability to utilize those fats. Then there's a whole endocrine system we have to deal with, so that would be another probably see if we fit question, but adrenals is the first thing that I would think about for that. Okay, and then finally, how do you stop or control hot flashes? This is the last one I'll answer in this category today. So again, the adrenal glands could be the reason that you are still having that signal coming from the hypothalamus that is saying, look, I need you to pick up the slack ovaries. You're not doing your job. The adrenals are actually sitting over there going, actually, we're supposed to be doing that right now, and we're a little too tired to do it. So that's one of the reasons that hot flash could be coming. There may be a couple other reasons. Sometimes there can be an iodine component to it, so observe and check out, make sure you're getting sufficient iodine in your diet. Sometimes it can be calcium. I find sometimes that people will mistake or misinterpret a hot flash as something else that's happening in their body actually trying to draw calcium out of the bones. And that can be a different type of hot flash. It's like a fever flash almost. So calcium, I would look at your calcium amount, I'd look at your iodine, but most importantly, I would make sure you're supporting those adrenal glands, mostly because it's no secret that people are under stress, and more stress than that what those adrenal glands were designed to handle. So it just makes a lot of sense to make sure you're supporting them. Rule those things out first. If it doesn't go away, then you're going to want to go deeper. You're going to want to look at your hypothalamic function and a few other things. And that's something, again, that you're going to want to talk to somebody a little more specifically. Okay, last two questions, and hopefully you're going to get this in the time. Please give me advice what to do about restless legs. The pain is horrible and missing a lot of sleep. Please try and help me. The pain is horrible. Carolyn, absolutely give us a call for the See If We Fit. But this is one of the things that I tell people across the board whenever I'm thinking about muscle cramps and pain. For 2 weeks, every day, do a cup of avocado or guacamole and a cup of black beans. Just do those two things. If you don't have any change in it, then you're going to want to dig deeper. But we need to rule out the basics, the most obvious things that are missing from people's diets: potassium and magnesium. And if you effectively eat those two quantities every day consistently for 2 weeks, you would be amazed at the changes in your life. So try that first. If you don't get any change, if it's not getting any better, you give us a call and we will do the See If We Fit. Okay, Carolyn? Thanks for the question. Finally, last question is Juice Plus is fruits and veggies. Is it though? Can they take it during the keto? Great nutrition and research. Okay. We did respond to this online, and I do want to go into this a little bit deeper. Okay, I don't want to say anything bad about that, because yes, you want to get nutrients from your fruits and vegetables, but we have to be careful when we're distilling things down to what we think is just like the active ingredient or the essence of that. You want to get it as nature packaged it for us, because there's so many other things in there, fiber being one of them. But actually, when we did kind of examine this a little bit deeper, and I don't mean to pick on Juice Plus at all, but we did find that there were synthetic chemicals and versions of vitamins and added sugar in the form of high fructose corn syrup, tapioca syrup, maltodextrin, and cane sugar. There's so many different things that were added in there that wouldn't be in actual fruits and vegetables. So for that reason, again, I'm going to be a little bit of a purist about saying I would prefer you're just eating fruits and vegetables and not trying to get it from something that's going to put those additives in there. And a lot of times they're going to be putting in chemical equivalents of nutrition. Remember, the whole food nutrition is an entirely different game than the synthetic versions of vitamins that people are putting in things that are most of the multiple vitamins that are available out there. So always think whole foods first. And if you guys haven't seen the 2 posts I made about walnuts and pecans, unbelievable research showing that it is considered the 3rd biggest reason for all these deaths, that people aren't eating enough raw nuts and seeds. Please, please, please add in some raw nuts and seeds into your life. It can make a massive difference for you. Okay, these are all these questions. I feel like we had a couple more coming in here. Yes, go ahead. Let me have one. I think we have time, right? Okay, we got 30 seconds. Let's do it. Okay, what do we got?
Okay, suggestions for food with more fiber.
Suggestions for food with more fiber. Okay, my number 1 is always going to be chia seeds if you are on keto, and avocado if you're on keto. And then what we just talked about, raw nuts and seeds. Make sure you're getting 2 to 3 handfuls a day. I usually say 2 handfuls a day, but if you're on keto, you may need to go for more to get more fiber in there. Chia seeds are going to be a great source for it, and avocado again. What else? Okay. How often should I cycle off? Two-part question. Keto and for how long? What should my target macro intakes be when I cycle off? Okay, so for keto, like I said, for me personally, because it's just realistic, I try to cycle on and off for 2-week periods because I find it's easier for me to do it. If you're doing keto for 3 days a month, you're doing yourself a favor. If you're doing it for 3 weeks out of the month, you're doing a great favor. I think it just depends on what you can do and what works for you, as long as you're getting all of those vegetables and all the micronutrients that go in it. So if you've been spending 40 years of your life never in ketosis, I would challenge you to try to extend that. But don't make it a burden on your life. Make sure that you're doing it in a way that works for you and it's not causing you more stress. And I think there was one last question here for us. What about having a cheat meal or two? Then going back on keto for like a week or two, will you still get into ketosis and experience benefits like weight loss? Absolutely. The more time you spend in it, the better it's going to be. And the more times you do it, the more you get closer to becoming keto adapted, where it gets easier for you to get into ketosis. Ideally, if you spend a long period of time in ketosis, that makes it a lot easier for you to get back into ketosis quicker. So, don't feel like if you cheat and then you knock it off, you've ruined the whole experience. You still had the great benefit of that, and now you have the experience to be able to know how to do it again. I have to shut this video down though because we're over time and I have to keep them short. Thanks for watching. Keep the questions coming. Next Tuesday, we're going to get into the rest of those endocrine and hormone questions. Have a great weekend.